I don't know how familiar people are with the work that UNICEF recently released on violence in terms of a data report, but there's some in the back of the room, and I'm not going to really address this today because I've been asked to talk about the evidence and the strategies we're using to address violence against children. But I'm mentioning this because we put together this because we wanted to have something to say with regards to the bad news, basically, that's finally been put together in one place. Is a compilation of data on violence against children that comes across 190 countries and pulls together in almost for the first time all this data in one spot. It's data that many of you have been collecting over the past 15 or 20 years, and you're acknowledged in the report. But the idea is to try and bring it all in one spot so that we can really show the magnitude of the problem and also start to use that data to address it. But we knew that when we launched it, that would be the headline, that violence against children, 1 in 3 girls victim of sexual violence, 80% of children victims of physical violence. We knew that would be the headline, and so we wanted to be able to say there's more to the story, and there's work that's happening around the world that really is making a difference. Okay, so we said, okay, so what are we doing globally to address violence against children? And we came up with kind of 6 common approaches that were being carried out in many of our country offices with our national governments and counterparts and partners. And sort of moving from a strategy that we had adopted in 2008 by our executive board that kind of laid out broadly to work on strengthening systems and address social norms when you're addressing violence against children, we said, okay, these are the 6 kind of approaches that seem to be common. So let's go a little bit further and say, what's the evidence about what these approaches, how far what they're able to do? And so we came up with the 6 strategies themselves. Are the first is we've heard a lot of in the past 2 days, supporting parents and caregivers, family support as the first strategy. The second, helping children and adolescents manage risks, that's sort of life skills, education, empowering young people. The third strategy is changing attitudes and social norms, addressing discrimination, gender norms. The fourth, promoting and providing support services to children. So that's more the systems work, the work that was discussed somewhat earlier today. The fifth is implementing laws and policies to protect children. And the sixth is recognizing the importance of data itself in carrying out, in actually moving the agenda and moving policy by having, for the first time, hard data on violence against children and working with many processes. One of the things that I work on a lot in UNICEF is with the U.S. Center for Disease Control and other partners on national household surveys that we've been supporting in say, 12 or 13 countries around the world, where we're gathering data for the first time in some countries at a national level to have a national baseline. And so we've seen it's an important exercise in terms of understanding the magnitude of the problem, but it also moves the agenda. So we included this as a strategy or an approach. That we chose the examples themselves. We started out saying only examples that have been fully evaluated, hopefully tested in more than one place. Then we got and are in the global south. Okay, so then we had to quickly say, okay, maybe we need to adjust that criteria some, and we also will use examples from the global north. And then we even further had to do some to look to more promising or innovative because the evidence is still rather thin. I say that in this room. We don't say that when we're talking to the policymakers. We say, no, we've got, there's things we can do right now. So I think that's a conversation that we would have here that we might not have if you had an opportunity to if you were trying to convince the Minister of Finance to make an investment. And the idea was that understanding that it was directed at policymakers, actors that would be in a position, not technical people, but people that would be in a position to start to maybe make some decisions with regards to this work. Consistently what we found, that there was a lack of a comprehensive baseline and evaluation of a lot of the work. We really had to dig, not just with each of you. Many of you provided examples and helped us to work on this and provided really good feedback, but also with our country offices and our regional offices to provide us with these examples, and it was hard to come by. But we did come up with some good solid examples in each of those 6 strategies. And in the booklet itself, which you can get online, I have a couple copies here. There's a link to the case and to the evaluation or whatever report that it comes from. So here's examples of the cases. You can see just by it visually tells a story that the parents and caregivers, we had an abundance of examples relative to the other examples, so that we could really show kind of very wide evidence of these programs that have been taken on board and are in progress and have shown some positive impact in terms of violence against children, reducing violence or addressing violence. The strategy where there was the least evidence was in the helping children and adolescents manage risks. These are evaluated programs that have shown some evidence of impact, positive impact, but we really had to dig deep and far to find them. And the changing attitudes, again, this is a little more complicated, although our actual evidence review says that where there's been the most investment in building evidence happens to be in this area in terms of prevention. There's been a lot of work on trying to find what the evidence tells us about prevention strategies, and some examples where we're starting to see that. So there's an investment in this area. Both, we know there's a huge investment in the program, but also a little more investment in terms of building the evidence case for social norms and attitude changing and all those kinds of activities. Where, at least speaking for UNICEF, where we make probably the largest part of our investment in promoting and providing support services and implementing policies and legal reform, was where we found the least evidence of impact. And I don't think it's because there isn't impact from legal reform, and I don't think it's because we aren't seeing progress. I think it's because we're not investing enough in building the case in these 2 areas. I think it's why today when someone asked Rachel about when the question was raised about legal reform and implementation of laws and whether or not that worked, and one person said yes and the other person said no. The fact is we don't have very solid proof that passing a law and implementing the law it has made a difference in some, at least at a global level. Perhaps there's examples we can show from the United States, as David Finkelhor said today, but we couldn't find it. We certainly couldn't find it to put it up here. And actually, let me just say one thing about this is if there's someone in the room who has a better example, the idea is that this is a virtual document, and as we find greater evidence or additional examples, we would be glad to share them and to have them rotating in and moving others out if you really have an issue with something that's up here. And then the last is, again, the data collection and research. There's been a significant increase, as we've all seen in many countries around the world, in improving our data in terms of especially the national household surveys, things like MICS and the school-based survey by WHO and the VAC surveys with CDC. But there is still a real challenge in obtaining the data in terms of the administrative data. What you were pointing to, I think that you've seen that as some progress in the Western Cape. Globally, we aren't seeing that much progress, and we see this as a real area of where we're going to need to make a greater investment, not just because it will help us to build the evidence and make the case, but also because it's a way of tracking our progress over time, and it's sustainable. These major surveys are expensive and hard to carry out, and there's probably better ways to go about it. We also listed some additional sort of indirect approaches that aren't so child-focused but have a positive impact on children, and Richard made mention of some of them already in terms of restricting alcohol, the image program, and Safe Streets, which is also known as Cure Violence. Just the example is called Safe Streets in Baltimore, and Bel Bajao in India. So this, I think, is just what I was just speaking to in terms of the lessons learned from the review. Yeah. So So what do we do with this? When you spend 4 or 5 months trying to find the evidence and find it, that it says that we need to really invest more, as Richard also mentioned, in building the evidence, but that the lack of evidence isn't an excuse for inaction. And I think this is where events like this, opportunities to have researchers working with practitioners and helping us to try and figure out how to do a better job in terms of building the baselines and building the monitoring and evaluation work, the action research that Kathy Ward is carrying out in the Western Cape, and many of you are involved in IRC, where we really are not waiting for the hard evidence, but trying to build the evidence as we go. I think that really is the response. It came up today earlier that the linkages between gender-based violence and violence against women, we need to do a better job of pulling that evidence together and working together more as a community, each trying to understand each other's perspectives and working towards a common goal. And from a UNICEF perspective, also being clearer about the whole life course perspective, to not just focus on early childhood, but to take it all the way through adolescence and understand those different stages. We have always said we do that, but I think we're recognizing more and more that if we don't do a better job of it for children aged 10 to 18, we're really missing a significant amount of children that are at risk and require better support and protection. The report itself ends with the SRSG on violence against children conducted a global survey on violence and progress since the Secretary General's report in 2006. And so the report itself lists her recommendations coming through that study, where she basically found some progress globally, some progress in terms of data in particular, and increased attention by governments to address issues of violence, but it's not fast enough, and it need to accelerate that progress. So we provided at the end of the book the recommendations that come from her survey. And I think, Jen, that's it. I'll close there. Thanks. Maybe just this is this End Violence initiative that we launched a year ago, and these are components of that initiative. And it was basically it's launched in New York after a series of incidents that happened both in the United States and in India and Pakistan, and I mean, just that there was a sense that as an organization, UNICEF had to make a very large and public statement about violence, and to communicate that, we needed to do more, basically. And so this is members of our executive board, and they having their End Violence stamp, which seems to be, it sort of went through Europe and other places as well.